medication reductions can be a part of this with their prescriber. And if their prescriber refuses to think about lowering medications because of these dietary changes that they made, they sometimes may need to look for a different prescriber. It doesn't mean they go off and do it on their own. There's definitely a middle ground. I think that's really important, that it doesn't have to be. And some people are so focused on macronutrients and getting into ketosis, they're doing it in this, processed food way. That's like the old Atkins diet where people didn't care about the quality of the food. There's all this Atkins processed food you can go out and get with all these sugar alcohols and oils. And you can definitely be in ketosis and not get that many mental health benefits. So I think doing it in a whole foods kind of way means you may not need to be in quite as high level of ketosis to get some of the same benefits. What I like to tell people is that these polyphenols that are in the plant world, they do very similar things to cells that what ketones do to cells. There's a huge overlap in terms of how polyphenols affect cells and how ketones affect cells. They both cause a little bit of a hormetic effect. It's a little bit of a good stress on the cell. And so if you're eating lots of polyphenols in your mildly ketogenic diet, you may get the same benefits as someone who's getting a super high ketone level who's not getting polyphenols in their diet. So that's one example, but also these other practices that support it, sleep and exercise, make a huge difference as well. And so if someone's doing that whole program, again, they may not need to get such high levels of ketones. And it really depends also on what condition they're trying to treat as well.